Hi, my name is Brooke. I'm going to be the nurse practitioner student taking care of you. We're going to do a head to waist assessment today, okay? So we're going to start similar to how we did before. Go ahead and look straight forward for me. So I'm just inspecting your head here. Everything appears symmetrical. I don't see any signs of deformity to your skull, to your facial bones. Your ears are symmetrical, your eyes are symmetrical. I'm going to look at your scalp here. He has got thick brown hair that's evenly distributed throughout. I don't see any infestations, no foreign bodies, no signs of lacerations or anything like that. Go ahead and sit your head up. I'm going to palpate your face bones. You just let me know if any area in particular is tender, okay? Go ahead and open your mouth up. Okay, close. There's some mild clicking there. Is that normal for you?
Yep.
Go ahead and sit up here. I'm going to palpate your sinuses here. So start with frontal, ethmoid, and maxillary sinuses. Any areas in there that are tender to palpation. Okay, now I'm going to just touch lightly on your face here. I just want to note if sensation is intact to your face. You feel me touching?
Yep.
Touching?
Yep.
Touching?
Yep.
Okay, cranial nerve 5 is intact. We're going to move down to your neck. Just going to have you look straight forward here. So your neck appears symmetrical. There is no tracheal deviation that I can see. There is no lumps, bumps, visible bruises I can see. Go ahead and turn your head that way. No jugular vein distension that way. Turn your head that way. No jugular vein distension. I'm going to have you go ahead and shrug your shoulders like, I don't know. Okay, cranial nerve 11 is intact with that. Go ahead and turn against my hand. Okay, against my hand. Okay, and up. Shrug your shoulders one more time. Okay, his muscle strength is noted to be 5 plus there, with resistance. I'm going to go ahead, I'm going to palpate your carotid, so just relax your head normal. Okay. Okay, carotids are 2 plus bilaterally and are palpable. We're going to go ahead and palpate your thyroid here. Go ahead and just swallow for me. Okay. Any pain with palpation?
No.
Okay. I don't feel any nodules, any masses, anything that feels abnormal. Your trachea is midline, as I kind of discussed before. Nothing abnormal there. We're going to go ahead with your eyes. So just tip your head up for me. Just looking at the outside of your eyes. Your eyelashes are evenly distributed. Your eyelashes are symmetrical. Eyelids are symmetrical. There's no drooping to one side. Your folds all look normal. There's no signs of any abnormal swelling, no discharge. Taking a look at the sclera of your eyes, they are white. Your conjunctiva are without inflammation. There's nothing concerning. I don't see any foreign bodies or corneal abrasions. If you look right directly at my nose here. So corneal light reflex is intact. There's no signs of ectotropia or endotropia, which would be the turning inwards of your eyelids, or excuse me, your pupils. Go ahead and look right at the center of my nose here. Eyes wide open. Just going to check how responsive your pupils are to light. So your pupils are equal. They're round, they're reactive to light, and they're accommodating. So that is all good things. We're going to do a quick visual acuity. So you would cover one eye. Go ahead and cover one eye. Read the furthest line down that you can.
LTFPH. TFPH.
Okay, the other side.
LTFPH.
Okay, perfect. And then we do the same with your eyes open. So you would be, given that you read the line that was 2020, you would be OD 2020, OS 2020, OU 2020. We're going to do confrontation here. So you're going to stare just directly at my face. You're going to cover on the same side. Go ahead and cover this eye. Go ahead and tell me when you can see my fingers.
Yep.
Okay.
Yep. Yep.
Okay, switch.
Yep. Yep. Yep.
Okay, cranial nerve 2 is intact. So now I'm going to have you look right at the center of my nose again. You're going to follow my finger with just your eyes here, okay? So. Perfect. So there were no extraocular movements, no abnormal movements, no nystagmus, nothing abnormal I can see there. Cranial nerves 3, 4, and 6 are intact by performing that test. So we're going to go ahead and do your ophthalmic exam next. So we'll have to turn off the light for this for just a brief second. I'm going to look into your eyes, just check to see that everything on the internal structures of your eyes appear normal, okay? So there'll be a bright light that you'll have to tolerate just for a second here, so just look straight forward. Perfect. I'll give you a couple seconds to recover. Go ahead and blink. And open your eye really big on this side. Perfect. So your red light reflex is intact. Your lens, vessels, disc, and macula are all able to be visualized. There's no abnormalities in the disc ratio that I can see there, which is all good. So we're going to go ahead with your ears now, just looking at the external features of your ears first. So they appear symmetrical. There's no lumps, bumps, bruises, cuts, anything I can see abnormal. There's no bleeding behind the ears, no signs of bruising, negative battle sign there, no signs of any infection that would make me think that there's any abscessed areas to your ears. Excuse me, palpating the mastoid bone, any tenderness back here? Any tenderness?
Nope.
Okay, I'm going to go ahead and look in your ears now with the otoscope. So I'm just going to have you tilt your head this way. Peek my head in. So there is a moderate amount of hair to the ear canal. There is wet brown cerumen to the ear. Tympanic membrane is pearly gray with no signs of effusion, no drainage to the ear canal on that side, nothing concerning. And then same with this other side, just a moderate amount of hair, some wet cerumen noted to the ear canal. No signs of effusion, no redness noted to the ear canal or any of the external ear structures. I am going to come behind you. I want you to repeat the next 3-letter or 3-word phrase that I say to you, just to ensure that your hearing is intact. So we're going to go CD8.
CD8.
BCD.
BCD.
Perfect. So cranial nerve 8 is intact by your ability to hear behind you. We're going to move on to your nose. If you look up to the sky here, I'm just going to take a quick peek in. Nears appear to be patent. There's no foreign bodies I can see there. I'm going to use the otoscope again. Have you look up. Just going to take a peek in your nose. Septum does not appear to be deviated. There's a moderate amount of hair there. Turbinates are red, but don't appear inflamed. They're not cracked. There's no sign of bleeding, no foreign bodies that I can see in your nose. I'm going to have you just go ahead and smell this candle. Tell me what it smells like to you.
Strawberry pound cake.
Okay, that's correct. Cranial nerve 1 is intact by your ability to smell the candle. We're going to move down to your mouth. So just looking at the external features of your mouth. Your mucous membranes are intact. They do not appear dry. They do not appear cracked. I don't see any angulated chelation to the corners of your mouth there. No signs of trauma or injury to your lips there. Go ahead and open your mouth wide for me. I'm just going to take a look at your mouth and teeth. So no ulcerations that I can see to your tongue. Your adult teeth are all present minus your wisdom teeth. I don't see any canker sores or any concerning ulcerations to the mouth. I'm going to have you open your mouth and say, ah. Okay, no uveitis I can see. Your tonsils are graded at about a 2+. They're a little swollen. No red exudate, no tonsil stones that I can see assessing you there. I would go ahead at this time. I would put on a gloved hand. I would feel around on the inside of your mouth for any areas of fluctuation or any areas that I was concerned were abscessed. I would also then take a tongue depressor, go ahead and test your gag reflex for all intents and purposes, we'll say it was intact. I'm going to have you repeat these 3 words after me. So go ahead and say light, tight, dynamite.
Light, tight, dynamite.
So cranial nerves 4, 5, and 7 are intact with your ability to do that. So go ahead and smile really, really big for me. Show me your teeth. Perfect. Puff your cheeks out. Right there. Perfect. Can you close your eyes really, really tight? Don't let me raise them. Don't let me raise them. Awesome. Now raise your eyebrows like you're really, really shocked. Okay, cranial nerves 5 and 7 are attacked based on your ability to do that. Finally, we're going to move on to your lymph nodes. I didn't see anything abnormal in your ear, nose, and throat exam, so I would expect these to remain not inflamed. So we're going to go preauricular. You let me know if any area is tender, okay? Postauricular, submandibular, submental, cervical, deep cervical, and supraclavicular. Any tenderness with any of that?
No, ma'am.
Okay. So we're going to move on to your posterior chest here. So we would just assume that you would be in a gown for this. So I would just take a look at the back. I'm going to go ahead and look for any signs, of an abnormal anterior to posterior ratio. For this patient, there's no abnormal diameter. His chest rises and falls equally and symmetrically bilaterally with each breath. I'm going to go ahead and palpate. You let me know if there's any area of tenderness between your scapulas.
No.
And then we're going to go down your spine, starting with cervical, thoracic, lumbar. Any areas of tenderness with that?
No, ma'am.
Okay, we're going to go ahead and listen to your breath sounds posteriorly. So I'm just going to have you sit. Go ahead and open your mouth and breathe normally for me. Go ahead and take a deep breath. Okay. Deep breath. Beautiful. One more. Okay. I don't hear any crackles, any wheezes, any adventitious lung sounds there. I'm going to have you go ahead and just sit up normal here. You just let me know if there's any tenderness here. Any tenderness on either side there?
Nope.
No CVA tenderness noted. So looking at just your anterior chest here, I'm going to have you take a deep breath for me. Okay, so chest rise and fall are equal and symmetrical still on that same side. I'm just going to palpate some areas here on your chest. You let me know any areas of tenderness and go ahead and take a deep breath. So no heaves are noted with inspection. I don't feel any thrills, anything abnormal with a deep breath. We're going to go ahead and listen to your heart sounds. I'm going to start with the bell of my stethoscope first. So we'll flip this around. Okay, we're going to start with aortic, pulmonic, Erb's point, mitral, tricuspid. Okay, and we'd flip over and do diaphragm, same thing. Aortic, also going to palpate a pulse here. Pulmonic, Erb's point, mitral, and finally tricuspid. So I would then go ahead and I would auscultate all the same heart sounds with you laying flat on your back. I would then finally auscultate all heart sounds with you laying in a left lateral position as to pull your chest or your heart further forward into the chest wall. So that's going to complete your assessment today. Do you have any questions or any concerns?
Think so.
Okay, thank you, sir.
Thanks.